Hi everyone, my name is Megan Kantz, and for my presentation I will be talking about Fibrodysplasia Ossificans Progressiva, or FOP. So to start us off, what is FOP? So Fibrodysplasia Ossificans Progressiva, or FOP, is a disorder where skeletal muscle and connective tissue, such as ligaments and tendons, are gradually replaced by bone, which is also known as ossification. This disease leads to bone formation outside of the skeleton, which limits mobility as it progresses. And on the right here, you can see an image of what a normal skeleton looks like compared to what a skeleton looks like of someone who suffered from FOP during their lifetime. So what causes FOP? FOP is caused by mutations in the ACVR1 gene, and this gene provides instructions for making the ACVR1 protein, which is a part of a group of proteins called bone morphogenic protein, or BMP, type 1 receptors. This protein is found in tissues throughout the body and helps to control the development and growth of the bones and muscles. On the right here, you can see an image of what the gene and protein look like. So, FOP typically becomes noticeable in early childhood and affects the neck and shoulders first, then gradually proceeds down the rest of the body and into the limbs. As the joints become affected, movement is severely restricted. This causes difficulties with a variety of things, such as walking, speaking, eating, and even breathing. If the ossification has become too severe around the ribs, it actually does not allow the lungs to expand properly. And on the right here, you can see an image of what the disease looks like whenever it first starts to form in a really young child. And then on the other side, you can see that the disease has progressed in a little bit older of a child. So, the initial diagnosis for FOP is often difficult for many reasons. First off, it is quite rare, only occurring in about 1 out of every 1,600,000 births, so it is not typically the first disease thought of. And diagnoses are also typically conducted with the help of families' medical records, but FOP usually results in individuals that actually have no familiar history of the disease. And one early sign that can identify FOP is that affected individuals are usually born with malformative big toes. And on the right on the image here, you can see an x-ray of a patient who actually has FOP, and you can see the misshapen big toe on their left foot. So as far as treatment goes, there's currently no cure or fully effective treatment for FOP. Corticosteroids are used to help minimize pain and swelling during flare-ups, and non-steroidal medication is taken in between these flare-ups. Occupational therapy and specialized devices such as braces and shoes to assist with movement can also be utilized. And surgery to remove the bone growth is not recommended at all, as it typically produces new and even more painful growth. And on the right here, you can see an image of what a patient with FOP looks like while they are still alive, and in comparison to a skeleton. So there are currently 3 different drugs that are in active human trials to treat FOP. The only one in phase 3, which is the final phase, is palovarotene. Since FOP is caused by a mutation that results in excessive bone growth, the treatment that inhibits this development could prove successful. So palovarotene could possibly reduce the volume of extraskeletal growth by reducing the BMP signaling that causes it. And the drug is currently being taken orally in a trial with 40 participants, all aged 14 and older, that have FOP. And in the image here, this is actually a pill bottle of one of the participants in the trial. So, Harry Eastlack was one of the most well-known and studied cases of FOP. Like many others with the disease, Islak did not show any symptoms at birth except for a malformation in his big toes, but that wasn't really thought of as being anything severe at the time. He was diagnosed with FOP in 1938 after being hit by a car and the injury not healing properly. Unaware of the consequences of surgery at the time, Islak went through 12 procedures that all resulted in worse growths. His case of FOP is believed to have progressed more rapidly due to all of these surgeries. By the age of 15, he was already unable to open his jaw to eat, and he passed away 6 days prior to his 40th birthday in 1973 from bronchial pneumonia. At the time of his death, the only movement that he had left was very minimal in his eyes, lips, and tongue. Islak has continued to contribute to FOP research even long after his death. In 2006, a team led by Frederick Kaplan from the University of Pennsylvania discovered that the ACVR1 gene was responsible for the disease, actually with the help of Islak's skeleton. So in this image here, you can see kind of a chronological timeline of the progression of the disease during Harry's life. You can see at age 6, I think he looks like a relatively normal child, and you wouldn't know that anything was wrong. And then even at age 9, even though symptoms were present at the time, it wasn't very visible. But you can see even only 2 years later how fast the disease has progressed. And then by the age of 20, he was actually placed into a long-term care facility because his family was no longer able to care for him. And then by age 40, he had unfortunately passed away due to complications from the disease. So the Mutter Museum in Philadelphia, Pennsylvania, is home to thousands of medical specimen exhibits for educational purposes. One display includes the bodies of 2 individuals with FOP, which is Harry Islak, who was mentioned on the couple previous slides, and Carol Orzel. Carol Orzel passed away in February 2018 at 58 years old. She actually saw Islak's skeleton on display in 1995 in the museum, and from then on said how she wanted to hang next to Harry at the Mutter Museum. And her wish came true in February of 2019 with a new exhibit featuring hers and Islak's skeletons to educate the public on FOP. And an interesting fact is that Carol also was an avid costume jewelry collector, so they have some of her jewelry on display there as well. So some facts about the disease that didn't really fit into some of my other slides is that only about 800 people worldwide are known to have FOP, which makes it one of the rarest diseases in the world. And the life expectancy of someone who suffers from FOP is only 55 years old. And any trauma, such as a fall or even as little as a vaccination, can cause inflammation and result in permanent growth in the injured area. Individuals with FOP must be very cautious that they do not get hurt. Flare-ups can be caused by other things, such as illnesses, like the flu or a cold. And on the right here, you can see an image of a young boy at age 13, and you can see how much the disease has affected the entirety of his back, and even in the bottom you can see how he shows the malformed big toes as well. Something that I thought was kind of interesting was that FOP was actually mentioned in season 3 of the popular television show Grey's Anatomy, and as seen in the photo on the right, the patient who suffers from FOP was being told that she was having complications from a flare-up of the illness. And this episode brought awareness of this rare disease to many people otherwise would likely have never known it existed or what it was. So to finish my presentation, I found these images of what someone who suffered from FOP during their lifetime looked like close up. And I thought it was kind of interesting to see how this disease truly affected the skeleton. So there are all my works cited, and thank you for listening.